Hello and welcome to another episode of your show Medical Talk. I'm Dr. Mohammed Al-Mahtab and Eidkum Mubarak. Dear viewers, our bodies are meant to feel some form of pain at one time or another. Whether we want to or not, that's another different story. Pain can come from a sprained ankle after a run, a burned finger from the stovetop, or the nagging pain of a headache after a long day of work. Pain is pain and it's not fun. On another hand, feeling pain is actually important because it is a warning that something is wrong in your body. The nervous system innervates every organ in the body, which means that a person can experience nerve pain in any structure of the body. It is because of the nervous system that people experience painful stimuli in the first place. The way the system works is a signal is actually sent along the nerve to the brain where it is interpreted. But what about nerve pain versus muscle pain? Are we able to tell the difference? Lots of valuable information about this important topic we will discuss with our guest today, Dr. Abdulhamid Hamad. He's a board certified in physical medicine and rehabilitation. He is also having a subspecialty in chronic pain medicine from the University of Toronto in Canada, but right after this short break.
Trigger points are caused by muscle injury. Muscles can be injured suddenly in accidents, or damage can occur slowly, due to repeated movements or poor posture. A muscle is composed of tiny fibers, which contract and relax in response to messages from the brain. When muscle fibers become injured or overstimulated, they cannot relax and form contraction knots. A trigger point consists of many contraction knots, where individual muscle fibers contract and cannot relax. Fibers, extending from the trigger point to the muscle attachments shorten, and form a tight band. The persistent contraction of muscle fibers compresses blood vessels and decreases their blood supply, leading to oxygen starvation and the accumulation of waste products. This irritates nerves and causes pain. Activated pain receptors generate specific referred pain patterns, depending on nerve passage and muscle anatomy.
Hello and welcome. We're happy to have with us in the program Dr. Abdulhamid Hamad, a board certified in physical medicine and rehabilitation. Welcome to Medical Doc, Doctor.
Thank you so much, Dr. Muhammad. Thank you.
Thank you so much. Doctor, we have a lot to talk about, but I guess in the beginning we would like to highlight to our viewers the main difference between muscle pain and nerve pain.
Sure. So thank you for having me to talk about this very important and vital topic, which is about pain. Before answering your question, give me just 1 minute to talk about pain in general, because everyone has experienced pain.
Yes.
And we were bothered by it, right?
Yes.
But would you believe that pain is a blessing?
Yes.
And I'm going to tell you how.
How?
So, for instance, when somebody accidentally touches a hot oven, the pain rings a bell calling for an action, and the person immediately pulls back their hand. Otherwise, a serious or even devastating burn might happen.
Absolutely.
So that said, and if you look at the pain this way, then you're gonna realize it's really a blessing.
It's a good thing
gift from Allah. Yeah.
Yes.
Absolutely, because it's protecting us.
Yeah.
Right. However, when the pain lingers and it becomes like a chronic, it lasts for a long time, then it becomes a problem by itself, requiring a special intervention. And here we, as a pain expert, come in to help the patient solving this problem. Now, let me go back to your question about muscle pain and the difference between muscle pain and nerve pain. From the name, simply we can say muscle pain is that kind of pain coming from muscle problems. When there is a problem with the muscles causing pain, or nerve pain, the pain is arising or attributed by any nervous system problem. And as you know, the nervous system can be divided into two main groups or organs. It's like a central nervous system that include brain and spinal cord, and the peripheral nerves, which innervate joints, muscles, and other organs.
Exactly. I think it's also important to highlight there are different functions for the nerves. It's not just sensory.
Absolutely, yeah.
So can you distinguish that for our viewers just before we go into more details?
Yeah. If we're talking about the peripheral nerve, there are like three types of functions. One of them, the sensory, which which take the sensation, and the motor, which provide the impulse for active muscles to do the muscles, and the autonomic nervous system, which controls automatically our organs like heart, breathing, which we do that involuntarily.
So, and all these are basically controlled by your nervous system, basically.
Absolutely.
Okay. Now, what can actually cause nerve pain?
Yeah, any lesion that affects the nerves might cause pain. For instance, one of the main, most common, diseases or problems is the burning feet pain in the patient with diabetes. And this is coming from the neuropathy or the nerve damage due to the increased blood sugar and insulin. This is a very common issue. One other problem is the carpal tunnel syndrome, in which the median nerve is compressed in the wrist and causing a lot of hand pain. And again, with the brain injuries, like having stroke, a patient might have like pain, central pain, spinal cord injury, they might have pain. So those are some examples about the most common diseases that are causing nerve pain.
Can a viral infection cause a nerve damage or nerve pain?
Yeah, sometimes it does, yeah. There is like neuritis. We know about neuritis, for instance, like either in the brain, encephalitis by viral infection, or the peripheral nerves. We know sometimes the cranial nerve, which is Bell's palsy, most of the time it's coming from a viral. There is like theories behind that. It's not very well confirmed, but there's a theory saying that this is a neuritis for the seventh nerve, cranial nerve, leading to Bell's palsy. Yeah.
And what about, because we talked about this in other episodes, the autoimmune system sometimes.
Yeah.
Could it attack the nervous system and could cause also pain?
Yeah, I mean, the autoimmune system, so auto nervous system is like, we know that it's parasympathetic and sympathetic, and usually it governs the function of the heart, blood pressure, temperature, respiration, and internal organs. And there might be some cases with pain, if there's like any tumor or other issues compressing on the nodules.
So what is the common symptoms associated with the different type of pains, basically? How do we distinguish, for example, the nerve pain from a muscle pain and other kind of pains, like, for example, as you said?
Yeah, absolutely. The location plays a role. If the patient is complaining from pain in this area, usually it's a kind of muscle pain. If it's a kind of aching pain, it's a muscle pain. If it's, in located pain, usually it's like a muscle pain. And again, for the muscle pain, there is some localized muscle pain which comes after strain or trauma or something like that. It's localized, or generalized or widespread, like fibromyalgia, which is a very common issue, which all coming from the from the muscles in the body. When it comes to the nerve pain, we know the nerves are structures in a very well organized way. It's like either brain, spinal cord injury, and the peripheral nerves, they have like specific route they can follow. For instance, we know that each nerve has its own dermatome, meaning the topography of the skin. So when there is a pain, usually it goes through that nerve. And as a doctor, we know that it's in this area, linked to that type of, or that kind of nerve.
So you can basically trace it.
You can trace it, absolutely.
And then you can find basically it could be caused by a hernia or a disc or something like that. because that can actually be linked.
Yeah, yeah.
And that we can distinguish if it's a muscle pain or a nerve pain.
Yeah, I mean, with the nerve issues, usually we say where and what. Where meaning where the lesion, where the lesion is, or what's going on, what's going wrong.
Exactly.
So it's a kind of diagnosing what's behind the pain.
Okay, it's kind of an unusual question, but do you think sometimes numbness to some part of the body could actually develop into pain?
Yeah, usually a lot of patients are coming to the clinics saying that we have a numbness. So numbness is a very common symptom that really bring patient to see a doctor. And numbness, in many cases, it's one symptom of the nerve damage. It's not only the all the symptoms, but it might be like one symptom of nerve damage besides like feeling tingling, feeling pins and needles, and burning pain. So a lot of time there is like a combination between these symptoms and the numbness associated the pain. Yeah, most of the cases.
So is it fair to say that there are some external factors that could cause the nerve damage and some maybe internal factors that could cause the nerve damage?
If you are saying like there's external factors
like a trauma, for example,
like a trauma, like a burn, absolutely, like the environmental causes, and there is internal causes, metabolic issues, infections, inflammation,
exactly.
You can say that.
Well, that's very interesting, but we still have more to talk about, but we have to take a short break. Stay with us. Welcome back. We're still talking in the studio with Dr. Abdul Hamid Hamad. Doctor, before the break, we were talking about nerve damage and all the other factors that actually could induce nerve damage. Now, in terms of diagnosing nerve problem or nerve damage, how do we come up with a definitive diagnosis? I mean, can you walk me through like a journey of the patient, for the patient to come to the clinic and walking through the diagnosing process?
Sure. I mean, let's take an example about the feet pain, burning feet pain in patients with diabetes. Usually that's what brings a lot of patients to see a doctors. So from taking the history of the patient, we know that those patient has a diabetes. So we put in mind that this might be arising or attributed by the diabetes, which caused diabetic neuropathy. Then we go with the patient about the details, the type of pain, type of symptoms they have. What type of the pain you have, like burning pain, cold is like painful for you, tingling, numbness in the area. How do you feel it? So they can share with us. So that's called undertaking the history. Then we move to the examination. There are like several tools for examining the sensation. We have pinprick. We use some sharp tool to check one type of sensation. Then we use like soft thing like a tissue or a cotton tip to assess another type of sensation. We use vibration. We use like heat and cold to test all modalities of the sensation. And also we identify the region that is affected. Is it only the feet or up to the knee? And if there is any dermatome, as we mentioned before the break, if this is like following any peripheral nerve or it's like SOX distribution. So that will guide us that it's more likely coming from the diabetes neuropathy. Then there is like a simple questionnaire, bedside questionnaire. We ask the patient to fill it in. It's called DN4. There are some questions the patient answers. Then I, like a physician, we examine the patient and answer the rest of the question. We sum the results, and based on the sum, we can see how likely the patient has the diabetes neuropathy. Then if we still need to confirm the diagnosis, then we refer for electrophysiological studies, nerve conductive studies, to test the nerve using the electricity to see the velocity or the movement conduction in the nerve, to see if what kind of impairment the nerve has. Then based on that, we put all together to establish the diagnosis, and we share the result with the patient, saying, okay, this is the diagnosis. You have like a diabetes,
Exactly.
diabetic neuropathy.
Exactly. Would you collaborate with the other doctors, like for example, endocrine?
Yeah. Again, we collaborate with the neurologist to do the nerve conductive study. In some hospitals, we as a physiatrist, we do it. But if the facility is not there, we need other colleagues from the neurology to help us doing the electrophysiological studies. And again, when it comes to the treatment, absolutely, we need the colleagues from the endocrinology to control the diabetes, which is the main leading cause for the problem.
Okay. It's interesting that you mentioned about the conductivity.
Yeah.
And the modality of the sensation, basically, because I know there are some patients who actually can feel the pressure.
Yeah.
If you tap on their feet, for example, they can tell you that I can feel the pressure, but they cannot feel the needle, for example.
Yeah.
So there are two different receptors.
Absolutely. That's called like pressure pain.
Yes.
And in certain diseases, the pressure pain increases. Like in fibromyalgia, the pressure pain goes up, which means when you press a little bit on the muscles, people say, okay, no, it's hurting, please don't. I can't tolerate it. Although the pressure is very minimal, but because their pressure pain threshold goes very, very down.
Very low.
And other cases, it's not affected, depending on the type of the nerves or the sensors are affected. Yeah.
Okay. Now, we go into the treatment part,
Yep.
basically. Now, I understand that nowadays, with all this new technology and the diversity of the treatments, medications we have, there are so many modalities. But let's start with the basics for treating nerve pain, basically. What's the basic line for treatment? And then how can we ascend, basically?
I mean, after establishing the diagnosis, then we know where the problem is coming from. We try to conquer the primary reason that's leading to the problem or to the pain, if we are able to do so. If not, we have to go to the symptomatic treatment. When it comes for the feet pain, burning feet pain in the diabetic patient, we know that the problem is coming from the uncontrolled blood sugar, and the problem is in the context of this issue, which is a metabolic problem, right? So it's a metabolic problem. So we need to tackle that. And for this, we need to collaborate with endocrinologists. We need to collaborate with the dietitian or nutritionist, to help the patient their diet. The best approach is the lifestyle approach.
That's the first thing.
Yeah, I mean, that's the best, because that will tackle the primary reason leading to the nerve damage, which is the diabetes, because the diabetes will affect the nerve and other organs in the body. So if we are able to control or to reverse the diabetes, then we are giving the patient a very good solution for their problem. And lifestyle approach is the best. American College of Lifestyle have identified six pillars for lifestyle, starting from good food, exercising, good mental health, good sleep, and relationships, and avoiding toxic substances. So these are like the 6 pillars for healthy lifestyle. If we are able to take the patient through this journey, we will be like achieving a great result. Absolutely, there is other issues for those cases, like proper footwear, which protect the foot. And then we have like some topical creams. In Canada, we usually use compound creaming. And we have some nutraceuticals, vitamins, other supplements to nourish the nerves. And the last and not the least are medications. We use medication. I put the medication at the last because I prefer to start in that sequence, try to conquer or to tackle the main problem, go to the non-pharmacological treatment, and if we still need, we need to go for medication.
But before we go into medications and pain medication, basically, we're going to expand on that in a bit. But I want to ask you about vitamin B12.
Yeah.
Because there is a big hype about that. Like, you need to take vitamin B12, especially for the health of your nerves. Is that true?
Yeah, for some extent it is, because our nerves really needs B12 to function very well. However, if the patient is taking like a very balanced diet and they are not insufficient in B12, then it's not always needed. But I know for vitamins, sometimes it's like a kind of trend.
Exactly, yeah.
Yeah, it's better to test the vitamin B12 before start taking the amount, because if there is a need, it should be we should be taking the enough amount. So we'll say, some people will say, okay, let's take vitamin B12, but they're gonna take a small amount, which is not enough to replace what they are lacking for.
Exactly.
So if you decide to take it, please do the test, then take how much you still need.
And the main challenge, I guess, for us as physicians is to fight all the false information that the patient can actually receive from social media and from other resources that not basically reliable. How challenging is it for us, especially when it comes to pain, as you know? Sometimes it's very hard to explain or very hard to define the cause. So sometimes the patient might actually drift away and use other resources, non-reliable resources, like, for example, social media. How serious this issue, in your opinion, that actually inflict on the patients?
I won't say like it's a serious issue, but it's a real issue, because social media in our life, we can't say it's good or bad. It's like, I look at it like a neutral tool. So it might bring something good, it might bring something bad to the patient. And we, like as a physician or other healthcare provider, we can utilize the social media to provide some good information, educating patient about what's there, how to take care of themselves, how to deal with the pain. I mean, educate them about their pain. So we can use this as a healthcare provider. We can use the social media to educate patient and guide them safely to take care and to self-manage their problem. And of course, there are a lot of people who are abusing the social media to give like a false medication and false hope for patients.
Exactly.
And I see a lot of them with like hundreds or thousands of followers. They are listening to them. So patients need to be very careful nowadays where to take the exact information, the good information.
I'm going to shift the subject now in a completely different direction.
Really?
As you know, now we have the pilgrimage basically coming back, and they just finished their Hajj rituals. So if you want to give one advice for the pilgrimage, basically, what would it be?
Yeah, sure. First of all, let's say like Eid Mubarak for everybody, and Hajj Mabrur, inshallah, for everyone. And we wish them like all the best. So, of course, I mean, going to Hajj, it requires a lot of movement and being very active. At the time, most of us nowadays are, minimally active. So there's a transformation between minimally active to be like hyperactive.
Exactly, fully
almost
active.
all the day, fully active throughout the day, doing manasik and moving from one place to another. So that will add a lot of burden to their musculoskeletal system, like muscles, joint, etc., etc., etc. So when they will come back, most of the time they will be having some kind of pain. If it's a mild pain, they can rely more on the natural resources, natural modalities, like using some heat pads, using some ice massage to massage the area. They can use some topical creams, some oils to do massage as well, taking some rest, sleeping well, taking some nutraceuticals like magnesium, vitamin D that might help their pain. And of course, they need to see a doctor if there is like a serious issue like a swelling, if there is a numbness, severe numbness, severe pain, if there is any weaknesses in their muscles. So they need to see a doctor that might be indicating some serious issues behind the problem.
Doctor, thank you so much for your time and for all the valuable information that you shared with us. And hopefully we'll be able to have you again with us in the studio in the future. And thank you so much for sharing all the information with us.
My pleasure, Dr. Muhammad. Thank you so much to giving this opportunity to communicate with people and try to, shed some light about these important topics, nerve pain and other type of pain.
I'm sure we didn't cover everything, but hopefully we'll have another episode with that. Until that time, dear viewers, we will have a short break and we'll be right back. Stay with us.
Assalamu alaikum. Eid Adha Mubarak. My name is Ayat Abruman. I am a physiotherapist. I hope for all Muslims around the world accepted pilgrimage, gracious efforts, forgiven sin. Today, I will talk about some exercise pilgrim can use to prepare his body muscles to reduce pain and avoid injuries, increase flexibility, mobility, stability, improve posture of the body during his journey, to avoid injuries, impairment, or any muscle fatigue. First exercise will be for quadriceps muscle stretching. This is muscle in the front of the thigh. We will apply this exercise. Straight your back, stretch your abdomen, then slightly bend your knee, grasp your ankle by your right hand. Hold 1, 2, 3, 4 until 20. You have to repeat this exercise 5 repetitions. Then repeat this exercise for another leg 5 repetitions. Hold 20 seconds. Also, we have another exercise to stretch the calf muscles. This muscle which located in the back of the leg in this area. So we will straight the back, then weight shift forward on the tip toe like this and flex the hip forward. Stabilize for 20 seconds. 1, 2, 3 until 20. You have to repeat this exercise 5 repetitions. These two exercises, quad stretch and quadriceps stretch and tiptoe stretch, this exercise will help you to walk easily during your journey and will make mountain climbing, walking for a long period of time easier to do.
Staying physically active is the key to help your body stay healthy. And that is why we always make sure to show you our fitness segment to help you with your exercise routine. So let's watch together.
Hello everyone, Coach Omar here again. Today we're gonna do a different type of HIIT exercises. As we all know, HIIT stands for High Intensity Interval Training. It can be simply defined as a high intensity interval training, which means that you will train for high intensity of levels and then you're gonna rest at lower intensity levels. It's so simple that you don't need equipment, so there are no excuses. Once again, you can do it at home or at the gym when you are having your headphones on and ready to get that pump going. It starts with high knees. You're gonna stand in your position and lifting up, alternating your knees up and high as a warm-up and starting to feel your legs burn. You're gonna do it for 30 seconds and you're gonna rest for 20 seconds and hit the next exercise. The second exercise, which is squat pulses, you're gonna stand shoulder width apart and you're gonna turn your toes to slightly face outwards. And then slowly start lowering your body deep enough so that your legs are parallel to the ground. And you're gonna maintain this position for 30 seconds and then you'll feel your legs starting to burn. Maintain this position for 30 seconds and then rest for 20 seconds and hit the next one. The third exercise will be hip thrust bridges. You're gonna lie in a supine position on your back on the ground. You're gonna alternate your kicks between the right leg and the left leg. It's a very strong exercise for glutes. And remember, strong glutes can only indicate a healthy spinal cord. And then you're gonna do this exercise for 30 seconds, and then you will rest for 20 seconds and head for the fourth exercise. As for the fourth exercise, it's Russian twist. It's a superb core exercise. It will build your muscles that stabilize your spinal cord. You will lie on the ground and slightly lift your body upwards and then start rotating to each side. Keep repeating this exercise for 30 seconds and then rest for 20 seconds and then hit the last exercise. The fifth and last exercise is push-ups. We all know push-ups. You need to lie on the ground with your hands shoulder width apart, and you just starting pushing the ground with your hands. If you are unable to do a single push-up, you can just modify the exercise into resting your knees to the ground, and you can just perform it for 30 seconds and then rest for 20 seconds. And there you go. You have your 20 minutes workout, no equipment needed, which means that you guys have no excuses not to train. Remember, eat right, sleep like babies, and train hard. El Captain out.
Well, that's it for our show today. Hope that you enjoyed it. And we wish all our pilgrims coming back from Hajj to have a blessing journey. Thank you so much for watching. Until we see you again, stay safe and stay healthy.